got it.
Well, welcome, Rachel Busman. Thank you for taking time to just spend a little bit of your day sharing out about what the QRS pilot is and really kind of taking a quick overview and slightly deep dive into that. And so I think I'm going to let you introduce yourself, and then I'll probably interrupt with questions if I have them. So take it away.
Fantastic. Thanks, Billy, for having me represent our work here with the South Dakota Quality Recognition Information System pilot. I'm part of a team that's working on this, and we'll kind of go over what that effort looks like, as well as some of the exciting things that are to come with this project. So thanks for having me. My name is Rachel Busman. I am outreach coordinator with the Child and Family Resource Network and part of the SDSU Quality Collaborative. A little bit about the background of this pilot. This was an RFP with DSS in which the SDSU Quality Collaborative applied for. Our work started last year in October and will go through next year of September 2024. Our short-term goals were to design and implement this recognition framework and pilot a study. That study looked at both family, or I should say both three family childcare centers, which included group family, which are smaller settings, but still licensed category of care, and then our licensed after-school programs in the state. And then really along the next goal of this would be to have the pilot inform what statewide implementation could look like for South Dakota. Our long-term goal with the pilot is to really elevate and enhance the quality of care given to children, provide some supports and structure to that. And we'll talk a little bit about that today of how this pilot is doing that. So there was an identified need by the funder to look at what the state could do to standardize a framework, benchmarks that include self-assessment, which is a key component of what South Dakota Afterschool Network is supported when it comes to the school age work that we're doing. And these benchmarks, I think of them a lot of like a large tent. Instead of a prescription for a program, it's a large tent of options that the program or the provider can choose to lean into that improves their quality and the complexity of the work that they provide to families and children. So this pilot is a test in our state. And what we did in creating these frameworks was we used the quality continuum, which is the national look across every state of what's been happening out there. So just because we're one of the last states in the nation to take our look at this doesn't mean that's a negative thing. And we've really used that to our advantage in how we've built this team. So I'll just mention here, Debbie Mathias with the Build Initiative has been a strong collaborative consultant through this process. And Debbie's worked with other states across the nation and has a really versed knowledge of hey, don't do what that state did. This is what they ran into, or you should really take a step back and try it this way with a continuous quality improvement lens. And so from the beginning, that's been really pivotal to this team of having a framework, what works in South Dakota, and navigating a suggestion that might come up and go, okay, well, this is where we're at in South Dakota, and how will that fit in here? So great to have our expertise to this team. This team is led by Dr. Ann Michelle Daniels, Dr. Eileen Garcia, myself, Nicole Lanning, and Amelia Bannister, and then Hallie and Carrie are graduate research assistants on the project. We won't be able to do this work without our coaches across the state. So Maria Pisek and Deb Owens are supporting the South Dakota Early Childhood System in that coaching component. And then we work closely with the system to provide professional development. You'll see some components in there, training requirements in the framework, and that connection of resources and activities that the system can provide. The system was also really pivotal as we started this last year in doing those pre-assessments. So we did some observations in the programs, and without the dedication of the early childhood enrichment system, we wouldn't be where we are halfway through this pilot. So really greatly appreciate that. And then Billy and his team from South Dakota Afterschool Network, collaboration from them has been pivotal. We got the opportunity to go to Utah with collaborative efforts to learn from Utah and how they really walk beside, I should say, their school age professionals with intention and a lot of support. And so that, along with some self-assessment work that we've been doing to support school age programs, has been so impactful to this pilot. And then another thing, we have some training house and some on-demand resources that have really been able for us to have the framework and structure to provide this pilot. Billy, you have to stop me if you have any questions as we go here. So
I was just going to tell you, I was just going to stop you and not have a question, but just to say, like, the funding that we received from the South Dakota Afterschool Network to partner alongside and work alongside with you all on this project really came from the South Dakota Community Foundation. So it's South Dakota dollars investing in South Dakota people, and it's really a great thing. So I just want to note that.
Absolutely. And that innovation to be able to look at this project in a different way and a different lens really could mirror it. We just built upon each other. There was, an assignment from both ways, and how could we collaborate together? And that was just, it was a beautiful component of how we could do that. And we as a team here grew immensely through that opportunity. So appreciate that. I'll just mention a little bit about the QRS framework. So those quality recognition information system frameworks they look different from a family home provider to a licensed school age program, right? This is a voluntary process. And this is a block step approach, which means that you would have to complete level 1 of what the requirements are to work towards level 2. There's 4 levels in the frameworks that we're working in. And we also acknowledge that accreditation is beyond what we provide in this framework, and a lot of times has a higher ask than where we're looking as a state. We're working on the descriptions of what that looks like, but a lot of times the evidence of proving where they're at is self-reporting, documentation, outside observation or assessment, as well as internal assessment to show that they're meeting those components. Again, that creating that large tent. So we think about different areas that we're looking at. We're looking at workforce, we're looking at professional development, we're looking at health and safety, we're looking at relationships and experiences. But through that, we identify, and what makes this pilot really amazing is the opportunity for a coach to walk beside that program to see where they're at and their continuum of enhancing quality, connect professional development opportunities that really can help their individuals that they support gain stronger competencies, gain resources, have reflection on their practices, as well as the quality improvement grants. And that focus was really when we meet as a coach in their coaching roles, we identify where the barriers are for that program. And so it could be furnishings, it could be activities, it could be outside space. It could be communicating with families and how they get fees to be sustainable, so that those grants can carry a lot of different areas and could be a real solution to supporting quality enhancements. And so that was a cool bridge that the pilot could look at and allow that flexibility to the program to really be heard on where they see themselves growing next. So just a little bit about the phases of this pilot. Initially, we worked with the national consultant and the state leadership to draft those frameworks. We really had a focus on continuous quality improvement. So you'll hear me say we don't have this like you have to start here way of approaching this project. It's growth mindset, mindset focused. We have a culture of enhancement. It's not a punitive component. So we will provide data and feedback based on some of the observations, but where they want to grow is up to them. If art and movement is where we want to start, that's where we start. So fostering that and really building that relationship was a key component. We also have an advisory group that provides consultation, making sure we have those experts from the field that are really doing the day-to-day, helping us be responsive to South Dakota context was an important component of this as well. In phase 2, we reached out and we started the pilot. Initially, we started in March of 2023 with our 10 childcare programs. And then that was quickly followed by group family programs and center programs. So, I'm sorry, family home after that. Out of school time programs are starting this fall, and we're super excited to walk beside them in this academic year and support what their journey looks like this year and how we can support that. So super excited for that. Participation and recruitment, we worked together with DSS, ECE coordinators. Billy was a huge marketer for us to this opportunity and what this looks like. But this is something new. And so that can be a little bit, there can be some reservations or vulnerabilities about that process. So I really want to thank for those that have allowed their voice to be heard in this. This is so important, and it really is going to guide what potential statewide implementation could look like for the state. So I appreciate that. We did do what we call pre-assessments, and it's an observation in the program, collecting data. And we will also do those at the end of the pilot. It's what we call post-assessment. And we're utilizing those monitoring tools and documenting the participants' progress or where they want to lean in, right? What does quality look like for them, and how can we support and enhance that? Along with the reflective questions that observation provided, right? Sometimes it's philosophy. And if someone's philosophy is different than what this tool is looking at, then we move to a different area. And let's look at something else. There's always another place to lean in. So the pilot, we're in this stage 3 right now, or phase 3, for most of them just finishing onboarding school age. But during this, we're providing those resources, the coaching, the financial components of those quality improvement grants, and just systematically monitoring them as we go through this and tracking what this process is looking like. We have the advisory group meeting. We also have coaching, peer, what we call practice-based coaching. And that COP is what we call it, community of practice, meets with coaches and the EC staff to go over lessons learned and, how can we have that strength and based mindset and foster that, and where do we have opportunities to grow and go next. So that's a cool component of where we're at right now. Because coaching is a hard role as well. It's really complex and there's a lot of hats to wear there. Our next step in the pilot as we head to next, so if we think about like next May through next August, right? In that time frame of 2024, we'll be doing evaluations, and there'll be multiple methods of collecting data, quantitative, qualitative. A lot of that analysis is even starting now with some of the pre-data that we obtained, and we'll be able to provide that information, DSS and the general public and stakeholders, about what this pilot looked like. And we'll be able also to bridge and consult with what does that look like for future recommendations for statewide implementation. So for the school age component, I want to focus on that today. We did choose to use the school age care environmental rating scale for the pilot. And some of these decisions were based on the capacity of our coaches having gone through training on this scale to be valid and reliable as an assessor. And so we're using this to look at interactions with the adults and children, the materials they have available, the health and safety of the spaces that they're in, and creating reflective questions off of that, and also bridging opportunities to enhance. So through the self-assessment, Billy, and I worked, and our team, whoops, I gotta go back here, worked really closely on the self-assessment tools to really have a strong enhancement for school age. School age can tend to get missed, I think, with there's a lot of need. There's a lot of programs in South Dakota. And so sometimes I think school age, because they care for school age children who can tell you like, oh, this wasn't great today, I didn't like it, don't get the intentionality that we really truly need. And so I'm so thankful for Billy and the After School Network to support some really strong self-assessment tools that could focus on health and safety, relationships and interactions, program management, and activities and experiences. So we've worked hard that the pilot could have these and give us feedback on what they look like. How are they useful? Did it help them move forward in setting goals for their program or seeing opportunities to enhance versus like a prescribed someone coming in and saying, oh yeah, your area over here and the lack of choice that you that the children have, you need to work on that. A self-assessment tool provides that reflection of, how does greeting and departure go? And am I connecting with parents and communicating with them? Is it warm? Is it receptive? Am I saying their names? Like those deeper components is what the self-assessment tools were set up to do, to provide some ideas where leadership and psych coordinators and even staff can go, oh, that's my next goal, or that's where I want to lean in next. And so I'm excited about that. Billy, I want you to add where you see those being super helpful.
Yeah, so I mean, here's what we know. We know that this work is really focused on licensed programs because it's through the funder is through the Department of Social Services, right? And that is their lens of where they work.
Yep.
And that's great, like obviously, but there's still a chunk of folks that are still doing great work in the state that's needed. And so we wanted to make sure that there was opportunities after this pilot and after all this is done that everyone could get some form of knowledge and some basis, right? Everyone can have that opportunity to say, this is where I'm at. Let me see, and just kind of have that base. So that was really our lens for that. And we saw that need, right? We saw that like you're taking care of this niche. Let's see if we can fill in some gaps here.
Absolutely. Yes. And so we'll see what we learned from the pilot, from launching that in the pilot to get feedback before we have that as a public facing, forward facing opportunity. But we do see that really enriching and supporting programs, as well as the program administration scale, which is the tool that administrators use to really look at your human resources and what is your feasibility and financial fiscal practices. Some of that gets a little, not why we came into the field, right? Like there's sometimes a little hard stretch, but still really impactful to quality, right? Because if we don't have some of those components, it's harder to really bridge the enhancement of our team and where we want to go. So those are some tools that really kind of make it well-rounded in what we're supporting at this point with the pilot. I did want to take a mention to our work, and Billy has also been supporting this with our South Dakota Core Knowledge and Competency Standards. And so this is an area where we're leaning into to create some common language when it comes to supporting our professionals in the field. So our core knowledge areas are where we know there's focused and should be intentionality behind the skills and abilities of the professionals and the educators that are serving in the field. And when we think about core knowledge and competencies, this tends to be kind of like, how does it bridge to higher education, right? Or how do you apply some of these in the field? We really had an intentional focus with this team to look at our workforce is highly entry level. They're coming in with some pretty limited skills and understanding of child development or developmentally appropriate practices. And how can we create a tool with these competency standards that allow them to see themselves in it as, I'm just understanding, like, why am I here and what am I doing, to the next step of I'm learning and applying and truly leaning into how to be the best professional I can in this role that I was hired to do. So we see this as a common language to talk amongst the state about where we're showing up for that professional development and that training. And also to have goal setting with our professional development from those that are in our field. It will allow individuals to say, you know what, this year I really want to find trainings on resilience and trauma-informed care and the wellness of my team. That's my goal, and be able to identify that by having some of this language in there that we share across the state, and can hopefully see some of the gaps that we have and also enhance what we do to support the professionals that are doing such amazing work, truly. Billy, do you want to add anything on that core knowledge and competency work? And we hope to have that done by January of 2024. So still very in draft at this stage, but something exciting.
I just want to say the group that's working on this is really impressive, like very diverse, come from different backgrounds, but also a lot of people in the field. And so that is really exciting to see and be in the room with, right? Sometimes it's just fun to sit back and like listen to them have the discussion, right? I don't need to say all the things all the time.
Yeah, I agree. I'm super happy that those that were approached that are currently in the throes of their supporting their program in their lane are showing up for this work. It can be a little overwhelming. It's overwhelming to me. Sometimes I'm like, are we heading in the direction? I know we are, but so I agree with you. So thank you to the core team, and there'll be more opportunities moving forward. If this is an area and you're listening to this and you'd really like to learn more, please reach out to me or anyone here at SDSU Quality Collaborative. We'll get you looped into that. But this was a key component. These core knowledge and competencies really came to light because one of the additional projects that we're asked to look at with this quality recognition information system was our career lattice. Right now is our career lattice in the state of South Dakota is called the Pathways to Professional Development. And this was the way that the state was looking at our workforce. You know, how many individuals have a CDA? How many of them have an out of school time credential? Where are they at in their pathway to stay in this profession or to engage in the profession or enhance their skills and ability? And also to help bring along those that come in and might have not come into it to see a profession, to be able to see that this is a profession and elevate the field. But when we were looking at how to tackle the relaunch and rebranding of the Career Lattice, it became very known that we had to get some core knowledge and competency standards in place, that common language of what skills and abilities look like, so that we have that opportunity to create this in the best light possible moving forward. And then we have strategy behind the decisions that are happening, was super important with this. So we will be working on that in 2024. We hope by the end of summer of 2024 to have a relook at what that looks like for that pathway to professionalism, and be able to support more professionals and engaging in that as an opportunity in our state. And also by engaging in it, it tells us on the policy side and on the workforce side what the workforce is and what the needs are. And that's super impactful when we're making decisions, when we know individual where they're at in the field, what they're looking for training, and have more communication with their needs, as I hope moving forward.
Awesome. Rachel, I cannot thank you. One, I just appreciate you and the work we get to do together. Like, sometimes it feels heavy work and sometimes it feels like fun, right? Like I think we do a good mix of both of those things. Yeah. But just like making sure, I just appreciate you and all the people you're working with, Department of Social Services, SDSU, just making sure and ensuring that school age and after school and summer programs have a seat at the table. Yes. And we just greatly appreciate it. Again, if you're interested in like participating or want to join in the conversation, Rachel's email is on the screen right now, and feel free to reach out. Already had some folks reach out about this. So thank you again for your time. And man, I just can't wait to do this again, maybe at the end of summer or next fall, and see where we're at, right? And just give an update. Yes. So that'll be so much fun.
Yes, please invite me back. I'd love to do that. And yes, like you mentioned, I am one of a big team of people, passionate people behind this work. I'm excited to share today, but no, none of this would be possible, one, without the team and the people we're supporting. The work that's happening in South Dakota is absolutely amazing. And these community champions that are providing school age care and center-based care and family home care truly are making the difference. And for us to lift up their voices in a collective way is, it's really fulfilling for me. So I appreciate being here and the opportunity to share that. So have me back. Love to share more.
Awesome. Thank you so much.
You're welcome.